Everything was explained to me from beginning to end. I was in day surgery. I just can't find any fault with them. They were amazing.
Bad thing about the hospital, I've had operation, I had it cancelled 3 times.
They do generally tend to listen to my concerns. In fact, at the moment I'm going through a hospital referral and they were brilliant.
I know it's probably due to the budgets, but that doesn't help the person that's trying to get some help.
The challenge is that money is certainly a big factor.
The GP I have is absolutely brilliant.
The doctor does need to listen, you know, actually face to face rather than like this all the time.
With what I've been going through this year, my GP has given me more information than any of the hospital, etc.
The hospitals are desperate really for more staff because they just can't cope with the amount of people that are coming through the doors.
There is culture change as well, which is needed.
They do explain what it's for, whether it's my diabetes or glaucoma or my chest, you know, breathing, and then the wife takes over.
Sometimes you have problems getting the appointment that is okay for you, because we only have a bus once every hour and then it stops at 2 o'clock in the afternoon. So if we get anything outside that, we have to get cabs.
I normally book it online. I can normally see any doctor within 3 or 4 days.
Booking the appointment is very easy. They looked after me very, very well. Really, I didn't expect it.
First in the queue, you find like after about 10 minutes, your doctor you want to see is normally been fully booked up, and when you ask how that is, they say, well, people have done it online, which I find is well out of order because not everyone has got a laptop.
If you phone early in the morning to our doctor's surgery, you can get an emergency appointment, but sometimes you have to wait 2 or 3 days.
They don't always tell you why they're prescribing and what they're prescribing and what it's for.
I felt so poorly. I didn't quite know what was wrong with me. And I asked Marjorie, would you drop me off at the surgery at lunchtime? I'm just going to go and see if there's anybody can see me. Well, I saw the owner, if you like, of our GP surgery, and he really told me off. He said that I dared to go at this time of the day and expect to be seen. And I explained to him that I just felt so ill. The trouble was I'd got an infection in my wound. So that's what was making me feel so poorly. I didn't make a complaint about it or follow any complaint procedure, but I did tell my own GP the experience I had.
He's quite straight with me. This is what I like. I don't want people waffling.
On discharge, the hospital said her leg needed to be dressed every day. The district nurses didn't come out till the day after she left hospital, changed it, and the lady turned around and said, oh, I'll see you tomorrow. Oh no, it'll be Wednesday or Thursday. The doctor wasn't coming out to see the patient. He was just leaving everything to the nurse. And when the family insisted that he did come out, he didn't even look at the leg. The family took it to Healthwatch, who then passed it on.
Just recently, I had an experience where they wanted me to go on statins, and I'd done a lot of research on statins, and I was not keen on statins at all. And he really did urge me to start taking statins. I listened to him, and I felt he gave me the best advice.
When I was registered blind, I used to try and cut my own toenails, which used to be a bit of a disaster, really. I filled in the form to have your toenails cut. I was turned down as not meeting our criteria. And the way I look at it is, if you've got diabetes, you can have them cut, but you can see. I can't.
The insurance companies, when you make a claim, they make sure that every detail you have declared matches your notes. Well, when I got those notes, I've discovered about 9 different entries that did not belong to me. Because I asked for a copy of my notes, it's only me who noticed this. Obviously asked for it to be corrected and for me to have a rerun of the 43 pages notes, and that's what led to problems. I kept on being put off, oh, can't be done today, come back tomorrow. And eventually, when I was downtown, I thought, oh, I'll pop in, see if my notes are ready now. And they still weren't ready. I said, well, I will wait. I was threatened with police. I thought, well, I've done nothing wrong. All I've done is sat in a waiting area twiddling my thumbs. After an hour and a half, 2 regular police arrived. To defuse the situation, he put handcuffs on me and dragged me out. Because after all this, I got in touch with my MP and I followed the complaints procedure, because it was then obvious that it was not my fault because the police had apologised. The GP explained the mistake. Somehow, records from another patient had been put on mine.
I have used A&E in the past. They were very good. It's a horrible experience laying on one of those trolleys.
They say between 1 to 4 hours, and you could be there much longer. If people was to be told what's going on, they would be a bit more at ease. But you got people who don't know how long they're going to be there, and especially you've got children, etc., because the children don't always understand what's going on.
He originally went into hospital following a fall. He was verging on early signs of dementia then. He was incontinent during the day and at night in hospital. He came home in an ambulance with a pair of hospital pyjamas on, no pad, no nothing, wet through. The ambulance driver said, well, she was so disgusted herself, she said, I'm going to report this.
The treatment I had for my prostate, it started at Bedford Hospital, and they referred me to Addenbrooke's. And I attended Addenbrooke's for 4 weeks of radiotherapy. I don't drive there, I would go by bus.
Bedford looked after me for a time, then referred me to the Royal Marsden. They explain things, and which makes it more understandable and you feel more at ease.
I was referred to Bedford Hospital for an MRI, and they explained what the big machine was all about, because I didn't know. I had never been in one. I was so much afraid. I thought it was going to swallow me up, so I cancelled my first appointment. But very patiently, they booked another appointment and they explained it's harmless.
We like to go to the eye hospital. I can't complain with the service at all. The doctors and nurses were amazing. Really, really good. The receptionists, everybody.
The discharge system, I think, needs a good overhaul. It takes time. Everybody's so busy. I don't think there's enough coordination between the different departments.
On the day of discharge, you're hanging around waiting for your letter of discharge.
The problem I found there was just the waiting time of getting your prescription, a doctor coming around, signing you out, saying obviously you were fit to go. But the aftercare I found was okay.
The surgeon I had was amazing. He explained from beginning to end. I had a couple of bad turns while I was in the hospital and I was kept in a little bit longer. But I'm not looking forward to the next one, obviously, but it's got to be done.
I've had a few hospital appointments recently, mainly with audiology, and so I've never had any problems. I get an appointment, and normally in Bedford Hospital there is a little bit of wait to actually see the department you want.
The only one gripe I've got is at the Luton and Dunstable is with the disabled having to pay for parking, which you don't have to at Bedford Hospital.
Referred to Addenbrooke's for my radiotherapy, Monday to Friday for 3 weeks. My appointment may have been at 10 o'clock in the morning, but I would have to be ready for 8 o'clock in the morning in order to be picked up by the hospital transport. We may have to go all through the villages to pick up various people. The car would be full, go to the hospital, everybody would go their different ways, and then when their treatment was finished, we sat and waited for the driver to take us back home, which could have been even 2 o'clock time. It was a lot of time wasted, simply because we couldn't get ourselves there.
I use Park and Ride because the hospital charges are expensive, and it's easier for me to go Park and Ride because the bus drops me right outside the hospital.
I wasn't happy with the aftercare because on the morning I left hospital, they stopped the home physiotherapist visits and everything. My husband had to keep phoning up, so I did get about 3 or 4 visits, but that was it.
Regarding the support at home, and there is a movement to try to treat more in the community rather than hospital, it's unfortunate that sometimes the physio is a bit delayed.
We were waiting for the OTs to come and do an assessment as to what needs he had at home. On the day he should have arrived, they rang me up to say, "I'm sorry, you're not in our area."
Well, I was a carer for my wife for quite a number of years. It got to the point where I was thinking sometimes, am I going to collapse or aren't I? The care in the home she's in is good, and it's nice that you can go and talk to the manager at, well, more or less any time.
I was so impressed with the way Healthwatch dealt with everything and how quickly everything went through and they were put through, that I thought I'd like to be a part of that. As far as I'm concerned, I'm giving back to the community that's given to me all these years. I'm giving something back. I'm relaying my personal experiences to other people. I want to try and influence other people to come and join and be a volunteer with Healthwatch.
They really have to change the health service in order to give a quality, sustainable service in the future.